The deadly spread of COVID-19 is forcing governments and healthcare providers to answer an increasingly difficult question. Where do we put all the sick people? In New York City, a nonprofit built a field hospital in Central Park. In California, San Jose expedited the construction of prefabricated microhomes for the at-risk homeless. In Kentucky, state parks are being used to offer safe housing for first responders and medical workers. And Georgia and Louisiana have opened public lands to shelter and isolate symptomatic patients.
The Department of Natural Resources began preparing Hard Labor State Park in Morgan County as a location for isolation and monitoring of patients. Let me emphasize, this is only a precautionary measure. Right now, there are several emergency trailers ready for patient isolation.
The first person to be quarantined on public lands, Joey Camp, arrived at Georgia's Hard Labor Creek State Park on March 10th. He had tested positive for COVID-19. Soon more would follow. Louisiana purchased hundreds of travel trailers and opened rental cabins in state parks for people with COVID-19 symptoms to wait for their test results. The state's lieutenant governor is overseeing the project.
When a person that's homeless or comes from a nursing home is tested, has symptoms that they believe may have this virus, they have to isolate them while the tests are being run. If they put them in a hotel or a hospital and it comes back positive, they would have to clean that whole place out and isolate everybody in that facility. If they put them in a cabin at a state park or a trailer and they come back positive, they only have to clean that one building or trailer. And if they're negative, they can put somebody back right in that place.
Louisiana has been hit particularly hard by coronavirus. They've reported thousands of cases, resulting in many deaths. Because of backlogs and delays in testing, it can take several days or even weeks for people to find out if they have the virus once they're tested. Putting vulnerable people in the park facilities ensured their isolation during those days of uncertainty. The challenge, however, is how to care for the sick people in the park while protecting workers who care for them.
What kind of resources do the people in those RVs have access to? We're talking water, food, propane, things like that, heat,
Right.
air conditioning.
They are fully supported by the teams in the parks with food, medical assistance, and those things are plugged in those spots in the state parks: electrical, plumbing, water, AC and heat, all the things they need to keep them in a comfortable setting. They've got large green areas, recreation. The cabins at Bayou Cineta are actually on the water. They were built after Katrina and they actually float up and down. So they're pretty luxurious cabins on the water there.
How are you making sure that the state park employees are safe? What kind of materials are provided for them?
We've taken all of our employees out of the state parks. So the only state park employee there is a ranger at the gate that is not having any direct contact with any of the patients. They're being brought in by ambulance and leaving by medical teams as well. So they are not interacting in any way.
These public lands take at least some of the pressure off caregivers. As many as 9.6 million people could be hospitalized during the pandemic. These trailers and cabins in the woods can serve those who are sick but don't need to be in a hospital and give them a safe place to recover. In a way, this fulfills the original mission of our public lands. The United States began protecting public spaces like these not just for environmental conservation, but as a place to restore health for people. They have served us for generations, giving us a place to rest, explore, and even find ourselves. And now they're fulfilling their original purpose, quite literally, a place to heal.